This is Jerry Hesch from Hesch Institute in Aurora, Colorado, and this is a method of self-mobilization of the first rib, which primarily gets restricted in the transverse plane. You can get a 2 foot by 2 foot piece of 1/2-inch plywood or a very large book and put that on the side of your bed at the edge. And you can reach with if you're going to mobilize the first rib, you can reach across with your left hand and pinch the upper trapezius muscle, where you can feel that if you could go through the muscle, your finger and thumb would touch. And then you take your middle finger and you go below that, and you are about 1.5 inches lateral to the middle of the spine, to the spinous process. And with your middle finger, you should feel that rib tubercle, which will be prominent. What you do is you take a baseball and you place it underneath that, and you can wiggle around on it and search for the tightest spot. And you let your head go off the table in mild extension. Just slight extension, or put pillows under your thoracic and lumbar spine and pelvis, and then your head will naturally fall back just slightly, about 20 degrees off those pillows. Okay, so this, laying on this ball, will gap it anteriorly. Okay, and what you want to do is, with your body weight, you want to shift the body weight down to the left slightly at about a 20-degree angle, and that's going to create a lateral and anterior directed force on that tubercle of the first rib. Then what you do, and so it's going to gap the posterior aspect of the rib, where the rib butts up against the first thoracic vertebrae and where it also attaches to the transverse process of the first thoracic vertebrae. You also want to gap the front of the rib, which attaches underneath the clavicle and attaches to the manubrium of the sternum. And so with your left hand, you're going to reach over and you're going to follow the clavicle with your left hand until it hits a bump. Okay? It's also a prominent bump on the top of the shoulder region, and you're going to capture that area with the palm of your hand, and you're going to push it posterolaterally. So I'm pushing it at about a 45-degree angle. Lateral and posterior, if you stack those vectors, then it would be a 45-degree that way. Okay, so you capture that and you push that posteriorly, and you maintain that force for 2 minutes. And that is the self-treatment technique for transverse plane mobilization by distracting the first rib.